Well, thanks, Jeremy, for the opportunity to be here, and thank you to all of you. It might surprise you that someone with a background like mine that didn't mention health would be talking about health. But as a new Member of Parliament, I realised very quickly that the single most important issue that faces the federal government, at least, without any doubt in my mind, is health policy. And so, like any good consultant, I made it my task to think deep and hard over the last couple of years about health policy, get involved in it, and look at it at a very local level as well as at a much more macro level. And I'll talk about some of that in a moment. But at the heart of the problem, in my view, is the need for innovation. And I'm very fond of what's known as Amara's Law. It's a very simple idea, Amara's Law, and it is that we consistently overestimate the impact of innovation and technology in the short term, and we underestimate it in the long term. And I've experienced Amara's Law in person with businesses that I've started 7 different businesses over the course of my career, and generally the failures were because I breached Amara's Law, and the successes were because we were aligned with it. And time again I've seen that innovation, if focused on technology alone, will fail. But as many years as a management consultant, what I learned again and again was that for technology and innovation to succeed, you have to get a lot right. You've got to get a whole series of things right. It can't be just the technology, it has to be the business model, the delivery model, the governance, and everything else around it. And when you finally get all of that right, innovation has impact. So what I want to talk about tonight is, for a few minutes, what I think has to change in the health ecosystem, the whole system, not just one piece of it, in order for genuine reform to have impact. And I actually agree that the co-payment as a standalone initiative was never going to be a genuine reform in the health system. It had to be much broader, much deeper, much more profound and much more fundamental. And so that's what I'll put to you this evening. But before I do, I think it's incredibly important to articulate the problem we're trying to solve. And many failures in government in recent years, I think, have been because we haven't articulated the problem. And I think the 2 previous speakers, Mark and Rowan, have articulated it pretty well. But I bring it down to a very, very simple level, which is that we have spending growing at something like double-digit rates. Now, I'm going to disagree with what was just said. I don't think that's sustainable. I don't think that's sustainable. And the simple reason is that the compounding impact of spending growing at close to 10% a year, different parts are growing at different rates, but let's say even if it was 7% a year, which is 2% above GDP in nominal terms, the compounding impact of that is that very soon that's all we're spending our money on. And in no economy will that work. It just simply won't. Politically, you will have a revolution before we get to that point. We'd have to raise taxes to a level where no one wants to work anymore. We'd have to stop doing everything else we do, and that simply is not going to happen. So we do have a sustainability of spending problem in my view, and the impact of compounding is quite extraordinary when you look at these numbers. The intergenerational report was much maligned. But at the heart of the intergenerational report was an incredibly simple proposition, the one that recently came out, 6 or 8 months ago. It seems like ancient history now. Incredibly simple proposition, and it was that if you have taxes rising at 3% and spending rising at 4%, in a relatively short period of time, debt will exceed GDP and you are Greece. That's it. Do it on a spreadsheet, 2 lines. 2 lines. That's all there is to it. Unsustainable. And at the heart of spending rising faster than tax is health and welfare. 2 big items in the federal budget, the 2 biggest items in the federal budget, and the 2 fastest growing items in the federal budget. So frankly, this is unsustainable. And whilst I understand that service providers enjoy that growth of spending, well, I would too if I was a service provider. There's nothing better than an industry growing at close to double-digit rates. It's wonderful as a consultant. They were the industries I always looked for. But the truth is that as a purchaser of services, which is what the federal government is, and we can debate whether they should be, that is just simply not sustainable. The second part of the problem is on the customer and the population side, and Rowan articulated this well, I thought. And the crucial issue here became very clear to me in my first week as a candidate in the electorate of Hume. Soon after I was pre-selected, I got access to the previous members' database of every constituent, and every local member or candidate has access to a big database, and if your previous member likes you, they will allow you into their database. And in that database you can see what people care about most. There's many years of records about what people care about most. And the overwhelming thing I saw was that the number one issue in my electorate by a country mile was health. By a country mile. Now it's true in my electorate, which runs from south of Sydney down to Canberra and west from there, there is an older demographic. But even when I looked at the regions with younger demographics, it was the same result. Health was number one. So people care deeply about this. This is a big issue for them. It's a big political issue and it's a big real world issue that they have to deal with. So that is the fundamental collision we've got going on. This is the number one issue, certainly in my electorate, for voters and for the population, and we've got spending growing at a totally unsustainable level. So what do we do about it? Well, as I said a moment ago, the solution has to be broad. And I bring it down to four different areas. The first is in technology, medical technology, and I'm using that term broadly to include both hardware and software, information management. Second, we need breakthroughs in how we deliver health, our workforce, our organisational models. Third, we need breakthroughs in how we fund and purchase health services. And fourth, we need breakthroughs in the governance model, and that includes the intergovernmental relationships and the relationship between private and public sector. So let me just expand on each of those four areas for a moment. In terms of medical technology, there's a lot of focus on e-health records. Let me tell you, that is just the beginning. That is absolutely just the beginning. When you look at the whole information flow around the health system, it is much more complex, much richer than just e-health records. There's patient registration, provider bookings, care tracking, the common patient record, which is the e-health system effectively, patient portals, performance management and analytics, which both the previous speakers talked about, the financial side of it, and all of that has to be linked across multiple providers, hospitals, doctors, specialists, pharmacists, allied health practitioners. And without that level of integration, you don't solve the problem. So that integrated information management, integrated systems is absolutely fundamental if we're going to solve the underlying problem that I've described. And of course on the hardware side, we've got a revolution happening in remote sensing and monitoring, not just in health, but in many, many industries. And of course, there's no doubt that'll have a big impact on health in the coming years. So that's the technology side, and there's many elements to that which are a good starting point, but none of that is even remotely useful if we don't solve problems in the delivery model. Right now we have a system which is based, at least in primary care, essentially on high levels of activities by GPs through consultations with a Medicare provider number which is used very regularly, and I would argue, and I've seen this in many cases, heavily overused for a basic consultation, and you are rewarded for activity. What we actually need is a system where you've got flexible, team-based, integrated workforces that don't focus on that one, overuse that simple model of a GP meeting a patient. And I'm talking particularly here in primary healthcare, which is the federal government's problem, but of course the same principle applies as you move to hospitals and specialist care and so on. Within that is a fundamental competition problem, which is that there's no doubt we've created barriers to entry for workforces, particularly for specialists, and the Harper Review looked hard at this, and there's no doubt we are going to have to deal with that in time. It's been a big problem in the US health system, and it is undoubtedly a problem in our system. The other part of the delivery model that clearly needs reform is in quality improvement processes, in measuring, using those measurements to adapt and change the way we actually provide these services will be fundamental. The third area I talked about is reforms in payment and funding models. And I think this has to be much more significant than many realise. And this is where I depart from the idea that just simply having a co-payment is going to do the job. We do have a fundamental problem of moral hazard and information asymmetry in health, and around the world we are seeing pretty significant changes in payments and funding models. We are seeing worldwide a shift to what many like to call blended payment models, where instead of just paying a practitioner for activity, you're paying them for outcomes. You are thinking hard about how you actually reward doctors and other health practitioners in ways other than just giving them $1 or a few dollars every time they actually do something. Now, much of that innovation is being led by the private insurance sector, and that I think is an important lesson that I'll come back to. That shift to blended funding models is particularly important when we get to chronic disease, and there's no doubt about it, whether it's diabetes or cancer or respiratory disease or so on, that chronic disease and how we actually pay people or practitioners for dealing with chronic disease will be critical. We're seeing this shift to blended funding models based on risk stratification and understanding the risk associated with each patient. Who's a high-risk patient? Who's a low-risk patient? Where are we prepared to pay more? Where are we prepared to pay less? Will be central to the sort of payment systems that I think are going to succeed in the future. And all of that requires integration across primary care, hospital care, specialists and so on. And that integration, of course, is at the moment being impeded by our federal model, again, which I'll come back to it in a moment. There is a lot of money in getting that right. And avoided hospitalisation, we know, through better primary care, is going to be a critical element in containing costs in the future. We know within that, in the payment models, there's a lot of work to do on compliance, on the MBS items, which we heard about earlier, and in the way we purchase the goods themselves. There's no doubt in my mind that the PBS, and I know some here in the audience will differ from me on this, the PBS has left a lot of money on the table, the pharmaceutical benefits scheme. And I think there are significant ways of reducing our costs, particularly when we're looking at generics, which again, the government has been doing in recent times. Let me finish then with governance, because I think this is the most important part of it of all. There is no doubt there is dysfunction between governments in the way we manage health. The UK healthcare system, the New Zealand healthcare system have a big advantage in that you don't have the multiple layers of government that are causing dysfunction. And the Federation White Paper, if it is to deliver anything useful in my view, must deal with that dysfunction across federal and state governments in health. Secondly, we've failed to harness private sector insurers and private sector service providers in the way that I think we need to. Most innovation, in my experience, will always come from the private sector. Yes, fundamental R&D can be facilitated by government, but if you don't have fiercely competing innovators out there looking for solutions to problems, then you're not going to get the solutions to problems. Government, as I am learning very quickly, is the biggest conglomerate in the economy, and therefore it is not innovative and it struggles to ever come up with innovative solutions to difficult problems if it's trying to do it on its own. So that failure to harness private sector insurers and service providers, I think, is a big issue we're going to have to deal with in the future. We have very, very serious resistance to that from unions, and we're going to have to politically find a way through that. I think the most important thing of all we can do on the governance side to drive those reforms is something that's already been mentioned, which is shifting power to customers. Shifting power to customers. And in sector after sector, people are saying how terrible it is that politicians don't seem to have the courage to drive reform. Well, the fact of the matter is politicians have one incentive given to them above all, and that's to win the next election. That's to win the next election. So if you really want reform, then don't give the power to the politicians, give the power to the customers. And whether it's in education or health or any other sector that the government plays a big role, I think shifting power to customers will force reform at a pace that government and politicians themselves will never be able to achieve. That means transparent information, it means taking away information asymmetries. I actually felt, and I'll use an analogy from education, one of the best innovations of the last government was the My Schools website, because for the first time ever, we could compare the performance of schools. Well, why don't we see that with doctors? Why don't we see that with hospitals? And we are starting to see that emerge around the world now, and I think that measurement and that feedback to customers and to practitioners will be fundamental in driving reform in the coming years. So thank you for the opportunity, Jeremy, and no doubt we'll have some good discussion in the Q&A.